Around 400,000 Mainers are enrolled in MaineCare. That's the state's Medicaid program. That includes half of all Maine children. The Maine legislature has still not passed a bill to plug an urgent $118 million spending gap in the program.
Now, the Mills administration is resorting to holding certain payments to healthcare providers until the money comes through. But how did we get here in the first place? Our Donovan Lynch looks into the roots of this financial situation.
This year, the state is coming up $118 million short in funding MaineCare, which provides health coverage to low-income residents. A Mills administration official says this is the result of a perfect storm of factors. Here are 3 reasons Maine got to this point. First, more people get their health insurance through MaineCare now than in the past. Important to note, the program, which is known nationally as Medicaid, is run by both the federal and state government. In 2014, as part of the Affordable Care Act under President Obama, states were given the option to expand who is covered by Medicaid to include most low-income adults. Maine signed up for this Medicaid expansion in 2019 when Governor Mills first took office. As a result of the policy, more than 100,000 Mainers got onto the program, according to the Kaiser Family Foundation. Then, during the COVID-19 pandemic, the federal government required health coverage to automatically renew for everyone on Medicaid. After the pandemic, that policy ended in a so-called unwinding period. But in our state and many others, the boost in coverage during COVID-19 stuck, and the number of people on MaineCare is still much higher than pre-pandemic levels. All this fueling a political debate in Augusta.
1, the system was never designed for it, and 2, they don't really need to be on it.
It is a good thing when people have access to the health care they need.
Now, the second reason behind this MaineCare funding gap is that health services are more expensive than anticipated. Part of that is because when the state pays healthcare providers, the price includes the cost of labor. And with minimum wage in the state climbing around 16% between 2021 and 2024, care has a higher price, according to the Department of Health and Human Services. Also, in 2022, the state put in place what are called rate reforms to increase reimbursements to healthcare providers. Both sides of the MaineCare debate agree with the need to pay providers what they're owed, but differ in their approach.
The level of reimbursement provided to those facilities needed to be improved.
This idea of rate reform became the justification for why the department didn't need to treat healthcare providers fairly at all.
Lastly, according to the Department of Health and Human Services, after a brief dip, members on MaineCare are simply using more health care than before. This too means a greater financial burden on the system, or at least one greater than was budgeted for, especially as state revenues level off. Now, because of higher enrollment, higher health care costs, and higher use of health care, MaineCare finds itself in a pressing funding gap. Now, what to do about it is a political question best left up to lawmakers in Augusta. For now, I'm Donovan Lynch, News Center, Maine.